Hey everyone and welcome. So for today, I had a few people ask me this really important question, and that's regarding painful latching or painful nipples and what they can do. So one of the most important things to remember is that I don't know about you, but I don't like to just cover with band-aids. I like to go to the source. So the first thing you would ask yourself if you are having painful latching, sore nipples is, what's the reason? Is it something like the latch? Maybe the baby's a little shallow. Now, when the baby's shallow, it will look like almost like the baby's kissing you. However, what you would want is a nice wide open mouth. Usually you would want to have about at least 140-degree angle of the mouth and like an ah position, like ah, with both lips flanged out. Not just only over the nipple, but the areola also. You should even see your temples can be moving in and out, your jaw will have a nice motion, and your nipple and most of your areola will be inside of the mouth. The more surface area of the breast is inside the mouth, the less pain you're gonna have. Now, let's say baby is latched well. Let's say the mouth is nice and open, but let's say it's still hurting a lot. You can also think to yourself, right, do you think it might be a tongue tie, maybe a lip tie? Usually with lip ties, it's kind of like this little string that comes from the lip to the kind of the gum line. Sometimes they'll have a hard time suctioning. That's something that your doctor will be able to diagnose, or even a pediatrician or a pediatric dentist, an ENT specialist. Just because a baby has a frenulum on like the labia, or like a labial frenulum, or even a lingual frenulum, which is underneath the tongue, that does not necessarily mean that it's a tongue tie. A tongue tie will mean that there's some sort of restriction. Is there a restriction of the tongue? Is there a restriction of the lips or the mouth? Are we having problems keeping a seal or a suction? If so, that might be a tie, in which case you can follow up with your pediatrician, ENT specialist, dentist, lactation as well, can kind of see, all right, do you think it might be this? Now, let's say you're still in so much pain. What are some things that you can do to help out with the pain? Now, there's a few things. One is you can hand express a little bit, put it on the nipple and areola and let it air dry for about 10 to 15 minutes. Then you can put on like hydrogel pads. Like I have these hydrogel pads, for example. I like the Modelo ones, but they have a whole bunch of other ones too. So you can put hydrogel pads and put your clothes on. Sometimes it also is painful if let's say your areola is very dense. Let's say you have oversupply, and when baby latches on, your areola is very hard, so it's hard to latch on very well. You might even need to hand express before the feeding, maybe to hand express and make the areola a little bit more softer, so then that can help to have more of the breast inside the baby's mouth. So we're making the areola softer, we're making it more kind of compressible. We can put some hand expressed breast milk around there. We can put hydrogel pads. You can also put lanolin cream or earth mama cream, whatever creams you have. Now let's say you are cracked, you're bleeding, you're sore. You can also think to yourself, do you think it might be something like Candida or mastitis? Now, what's the difference? Candida is more of a fungal infection. That is like thrush. Let's say you or baby has thrush. That will feel like burning, stinging sensation. A lot of times it'll feel like stabbing that comes from your nipple and go all the way inwards. So if you're feeling that, you can ask your OB and see if they can get a prescription for you for an antifungal, or you can also use a water and vinegar solution as well, and sometimes that helps to help with the Candida. If you do end up with Candida, you want to make sure that both you and baby are treated. You'll have throbbing, stinging, burning that usually comes from the nipple inwards. Sometimes you might even have white specks, either you or the baby. Now, mastitis. Usually mastitis is going to happen. You'll see red, you'll see hot to the touch. If you feel like you have a flu, pretty much, coming from the breast. You might have a fever. You might feel lethargic. The treatment for mastitis would be antibiotics. So let's say you have a painful latch. You're cracked and you're bleeding, you're sore. You've tried hand expressing and putting the breast milk. You've put maybe some lanolin cream or other creams. You've put hydrogel creams. Now, it's really painful. What do you do? Or it's time to nurse the baby, but it hurts so bad. What do you do? So my favorite technique is to lean back. That's when you might latch the baby on and then simply lean back, literally like a 20, 30, 40, 30, like almost like a 20 or 30 degree angle, where you're almost completely laying back so that the baby can be directly on the breast and gravity can hold the mouth open. By doing that, that's going to allow gravity to kind of prevent that compression where you don't want it, to hopefully prevent more damage to the breast. So you would want to have like a lean back position. If it's really painful, you also can try pumping that side until it gets a little bit better, or you can also try a nipple shield for a little bit. It's just nipple shields we try not to use unless it's absolutely necessary. So for the healing part of it, we can have creams, we can have your breast milk, we can have your hydrogel pads. We also can see if it actually needs to be treated by the OB. Let's see if it's Candida or Mastitis. We want to also try to heal the area in the process by either laying back. Maybe we need to pump it if it's that bad, just that side. We might need to open the mouth better, have a little bigger of a latch, and that can help as well. I really hope that helped to kind of clear some stuff up. If you have any other questions, feel free to leave it down below in the comments. And also you can feel free to subscribe and have access to all of my other wonderful videos. Have a wonderful day. Bye-bye.